So welcome everyone to our session today on healthcare provider burnout during the COVID pandemic. Thank you so much for joining us. I'm Dr. Mary Brindle, chair of today's session. I'm a pediatric surgeon and health systems researcher and director of safe surgery and safe systems at Ariadne Labs. Before I continue, we want to set up the language interpretation for this event. We do have interpretation available today in English, French, Portuguese, and Spanish. And to enable everyone to fully hear the translated event, we all need to click on the globe interpretation icon on your Zoom screen. So that's along the control bar, the same one that lists the number of participants in the chat box. It'll be right next to that. And then just click on that and select your preferred language. And even if your preferred language is English, which is going to be the language in which we conduct today's event, please do click on English if that's what you are wanting to hear this in. While this event is going on, you can choose to mute the original audio, and that will allow you to have a bit of a clearer sound. I'd also like to start by thanking the co-hosts of this event. That's Smile Train-Lifebox Safe Surgery and Anesthesia Initiative and Ariadne Labs, as well as our partners, the G4 Alliance, Seed Global Health, Frontline Health Workers Coalition, and the Act for Health Workers campaign. A few housekeeping items. Where people's internet bandwidth allows, we'd encourage you to have your cameras on. We are going to be recording the panel discussion, and we really welcome people during the panel to please put your questions into the chat box. Although we have some set questions, we're very happy to answer anything that comes up from the group, and really we want this to be an interactive discussion. So please feel free to put those questions up. We will try to save some time at the end for an open Q&A. And at that point, we will stop recording so that people may have an opportunity to chat about their questions and experiences. So please do be active participants in this. So now I'd like to start the session. And I'd like to start by saying that the issues that we'll be talking today about are universal, but everyone has their own particular experiences with wellness and burnout. In my clinical work, I come from Alberta, Canada. We are just going into a very difficult wave right now, and really we're taxing our resources. I also recognize that yesterday in the United States was Physician Suicide Awareness Day. And like many of you, I have lost friends and colleagues to suicide this past year. So I think many of us recognize the really importance of this event today. So I'm delighted to turn to our speakers for their introductions today. You may see if you've been following our social media that there's a change in the lineup of our panelists. One of our speakers was called into the OR for emergency work today. And so we're really grateful today to have Comrade Lawal-Aiyedun, who's been able to join us today, as well as Dr. Milind Shah. And so thank you so much for joining us with such late notice. So at the first, I'd like to give the opportunity for our panelists to introduce themselves. And Bunmi, I'll start with you. And you're muted right now, just so you know. Perfect.
Okay, thank you very much for inviting me. Thank you, Lifebox, my train. My name is Bunmi Lawal-Aiyedun from Nigeria. I'm a pediatric nurse, the immediate past president of National Association of Nigeria Pediatric Nurses, and of course, a board member of GIGS. I'm so super excited to be here today. Thank you, and over to you.
Perfect. Milind.
Well, thank you very much for this invite. Indeed, pleasure to see you all. Basically, to understand this burnout, which is a need of the time, I'm Dr. Milind Shah. I'm consultant OBGYN, practicing in India. I practice at two places, one called Sholapur and another Mumbai. I am past president of Indian Society of Perinatology and Deputy Secretary General for the Asia Oceania Federation of Perinatology. We were frontline workers for the attending COVID positive cases with my wonderful team. And that's what actually we are going to discuss today about our experiences. Thank you very much.
Thank you, Dr. Shah. Jahnavi Kedare.
Thank you. Thank you for inviting me here today. I'm a psychiatrist. I'm an additional professor in Department of Psychiatry in TN Medical College and BYL Nair Hospital, Mumbai, India. I have been in the field for about more than 25 years now, with an experience of clinical practice in adult psychiatry, as well as my special area of special interest is geriatric psychiatry. In COVID pandemic, our hospital was a dedicated COVID hospital, especially in the first wave, and our hospital catered to about 1,100 patients during the first wave throughout. So I was a part of the counseling team of the hospital, which was run by our department mainly, and we carried out various activities for COVID positive patients as well as for healthcare workers. We had counseling sessions for resident doctors, and we used to make phone calls to all COVID positive healthcare workers, doctors, nurses, other staff members, laboratory technicians, even administrative staff, whoever was admitted in the COVID positive wards, and conducted counseling sessions for them. So I think we have had a fair share of work with healthcare workers since last year. Thank you.
Oh, thank you so much. Dr. Jeff Taxman.
Thank you, Mary. My name is Jeff Taxman. I'm a psychiatrist and psychoanalyst in the United States. One of my specialties is in dealing with first responders during massive community disasters. I've also served on the National Committee for the psychoanalytic response to COVID and developed a description of a syndrome we've been calling PTSE, pandemic trauma and stress experience, and I can touch on that a little bit during the discussion. Thank you, Mary.
Oh, thank you. So we're going to get started on some of these questions. So as I've said, please, if there's anything that comes up from any of our speakers, feel free to jump into the chat. We're really eager to hear from your experiences and also to have you ask questions. So Jeff, I'm going to come back to you. And I think you have some slides to share with us. Could you give us a little bit of a description of what we mean when we refer to provider burnout, so that we all have a shared understanding of what this means for us during the COVID pandemic?
I'd be happy to, Mary. Let me find it. Burnout is a very important subject that doesn't get discussed all that frequently. It's one of those things that happens to some other physician, not to me or to my friends. And that's because we tend to be type A people. The people that go into medicine tend to be the ones that put up with stress. In fact, being able to handle stress when you're on call as a resident, when you have to get by with very little sleep, used to be a badge of honor. And it always felt important to physicians and residents not to show stress or to show that you have weakness. This is also true with military and police and other type A people. Yet, as we see from the first slide, the prevalence of burnout in a recent Medscape survey is 40 to 46%, and that's been consistent over the last 10 years. So one could say, if it isn't you, it's the person next to you. It is very common. And when we talk about burnout, it's used very cavalierly, but it is a serious syndrome, and we describe it in three qualitative dimensions. One is the primarily emotional but also physical fatigue or complete exhaustion. And many of us are used to working under stress, and we're used to working tired. But with burnout, it exceeds the capacity to go back to a balanced way of being. It exceeds the capacity to return to one's normal functioning, particularly the emotional fatigue. And what does that look like? That leads to the second point. It is a cynical or cool or aloof way of approaching work, approaching your patients, and approaching your colleagues. They call it depersonalization, but when you hear that, a lot of people imagine that that's some, strange thing. No, it's that your normal personality at work, the way you normally are yourself, is different. You're cooler, you're aloof, you're removed. And the third aspect becomes a vicious cycle, and that is you become less efficient, which then decreases our typical sense of accomplishment and professional esteem because we're not as efficient and we're concerned our colleagues know about it, which then further decreases our effectiveness, which begins a vicious cycle. And it goes back to the emotional fatigue. We don't have the tolerance to put up with that and overcome it. And so we continue down the spiral. This was originally described in 1982 by a psychoanalyst named Freudenberger. And I still find this wheel useful as a way to think about it, especially if you think of medical training. Think of residents who are highly susceptible to being burned out. But also, especially during COVID, almost all of us who are understaffed, overworked, and don't have the resources, we all have this compulsion to prove that we're good enough, so we work harder, neglect our own needs, and then displacement of conflicts. Instead of being able to appropriately identify where there is a conflict, we either begin to personalize them or externalize them, and we lose focus on where the real problem to be solved is, and we begin to revise our values. That is, our values of do no harm, of helping others, of being generous of ourselves toward a purpose, begins to get revised downward. We lose the values that made it worth our doing our work. We deny the emerging problems of our own beginning burnout. We withdraw. Our behavior changes. Like I said before, our professional self-esteem begins to drop. That's the depersonalization. One feels more empty and less rewarded from work. That can lead to depression and burnout. There are internal factors and external factors that contribute. I won't go through them all, but the external factors are what one might expect: high demands at work, difficulty or us versus them with leadership, admin, and lack of collaboration, time pressures, atmosphere being bad at work, lack of resources, poor work organization, lack of clarity about roles. And again, think of COVID, which I'll touch on in a second. All of this became very confusing and difficult. Internal factors for physicians: we have very high self-expectations. We expect perfectionism, especially vis-a-vis our patients. We have a strong need for recognition. And sometimes that's from outside, but very often we need our own recognition. For example, when I do disaster work, I know for me, it's a big thing that I'm doing it. I don't need anybody to know my name. I don't need anybody to say thank you. But for me, I know I'm doing something. And that satisfies the need for recognition. It doesn't have to be external. Likewise, wanting to please other people. You know that the patient you've helped, internally at least, is happy about it. We put off our own needs. We somehow feel irreplaceable, even though consciously we know there's another doc down the hall that can do our work. And for many people, work becomes our most meaningful activity as far as defining who we are. Sorry, I've lost this for a second.
And Jeff, you're no longer screen sharing, just in case.
Yes,
Oh, perfect, perfect. Sorry.
There we go. So COVID makes all the things I just mentioned so much worse. What I was talking about and the studies that showed it at 40 to 46% were pre-COVID. So what COVID has done is it exacerbates all of the previous issues. It puts them on steroids, if you will, but it adds a few extra things to it. One is the loss of praxis. And I think this is extremely important in generating burnout and depression and ennui from COVID. That is, everything we used to do and everything we could count on, both intellectual memory, muscle memory, and functional memory, that is praxis, has been changed. How we gown, how we prepare, who we can talk to, how we look to our colleagues with masks and face shields and the rest is different. The procedures you can do are different, and very often, much to your increased stress, are subpar. You're being told to do things that 2 years ago would have not been considered best practices, and now you're told it's okay to do that. Or in the beginning, to wear masks you know are not going to stop a virus, or to use cloth. These things take a toll on us because when we get scared or stressed, we rely on our skill and our praxis. We also lose our personal praxis, the things we normally do and almost take for granted as a relief of our day-to-day stress has been changed due to COVID. And that leads to a loss of the balance in our lives. Normally, if we're doing well and we're avoiding work stress, it's because we can balance the stress at work with our social, personal, sexual, family, and entertainment life. COVID has removed that and has shifted the balance, unfortunately, in favor of work. And that work, at least for the beginning, and now for many places it continues, has been loaded with fear. Fear that is antithetical to how we think of ourselves as physicians. That is, we are afraid of our patients. And we are afraid of our colleagues. And that is very different than we've trained for years. So it makes our workplace uncomfortable, it adds to the stress, and it makes it more difficult to find relief in the things we normally do at work. It's also added a fear that we may be the vector of harm to our families while we're at work, which would make us, because we are afraid that we might catch it at work, bring it to our families, which brings us to resent work and makes it more difficult to be there. We coined an expression called pandemic trauma and stress experience rather than disorder, because it's something everybody around the world has been experiencing. And it leads to, for many, many people, an ennui, a listlessness, a dissatisfaction, and almost withdrawal, difficult to get up in the morning and go to work. It feels more difficult to participate in life. And that goes back to feed into our sense of burnout, both personally, but specifically professionally. With that, if there are any questions, I'm happy to take them. Otherwise, I will go back to Mary.
Perfect. Thank you so much. And please feel free to add some questions in. I really enjoyed that, as always, Jeff. We'll move on to Milind. So you've worked as an obstetrics gynecology specialist in one of the worst affected areas of India during the recent second wave. And you also coordinated the COVID response in your district. Could you share a little bit of the experience that you and your colleagues had in terms of provider burnout and wellness?
Yeah, thank you very much, Mary. In fact, yes, when I heard about this session just 30 minutes before, Mary, I was so confused, and I was just thinking over that what I should share. Because, as the level was saying, when pandemic came, first wave, we were so confused because every day we used to get new guidelines. Every day we used to see new experiences. And what actually happened more so in India, that India works in two sectors. One, the government sector, and the other is the private sector, where all health services are given in these two categories. To start with, as the pandemic came, the private sector suddenly, was a bit confused because of lack of resources, because of lack of manpower, because of lack of adequate space for catering the COVID positive mothers. So basically, I'm going to tell more about the COVID and the pregnant mother because I'm OBGYN. But then a lot of actually the load started going towards the government sector. And then we realized that before we think of ourselves, we must address the burnout of all those government sector doctors, nurses, anesthesiologists, OBGYNs, and paramedicals, because they were unable to cope up with the number of cases they used to have in the government setups. And all those junior doctors who were working there were really tired. It happened so that one of the intern doctor in the local medical college in Sholapur committed suicide because of the overburden of the work. And that opened the eyes of many of the private sector doctors. They thought, we need to form a team. We need to come forward to rescue all our colleagues as well. And that's how we actually decided to work in the private sector as well to cater the services for all those pregnant women who were COVID positive. At the same time, there was a lot of fear and burnout actually feeling amongst the patients as well, because they were confused. They were thinking, now I am pregnant. I am 7 months amenorrhea. I'm having a near-term pregnancy, and who's going to look after me? And then we thought we must address these issues again very effectively. I will just quickly share certain pictures here so that you can understand how actually we could do it. Can you allow me to share the screen, please, the organizers? Yeah. Yeah, thank you very much. Yes. Yeah. So our experience started first awareing our own actually the patients, because they were also not understanding how they should go about. Now this particular all leaflets will find in the local language, whereby we published this in the local newspapers. We published many videos to explain all those pregnant women how they should go about when it comes to the COVID positive status and pregnancy. We also told them about the visits, how they can reduce the antenatal visits, how they can address their issues of lactation, how they can deal with their post-acute delivery vaccination to the babies. And all those things, when we started telling to our patients, many of them, they were very, very happy. We also started giving a lot of radio talks to tell our own colleagues that how actually you can contribute for this particular noble cause by giving your expertise in this particular pandemic scenario. And what the best actually work, I will tell you, Mary, was this webinar which we conducted with Lifebox in the RCOG exactly 1 year before. You can see the date, it was 19th September. And on the same date, we collected all those actually the doctors, nurses, the paramedical workers, and we told them, yes, there are good practices in COVID as well. And I'm so happy to tell you that many of them, they came forward. The feeling which we had that most probably no one will come forward to help we as a team, but you can see they were very much ready, though there were so many issues. Now, actually the training was not pertaining to only doctors and the nurses. You can see to the extreme left, she's a class 4 worker, what we call as a medical, the attendant in the hospital. But we trained her as well because we thought she will get tired once she realized that she may contract this particular infection and she may land up with ICU or the ventilator. But we told them, yes, we need to see that every one of us, the entire runner nurse, the OT assistant, and everyone should be well protected. And to our fortune, when this due care was taken, none of them, they got the COVID in spite of delivering so many pregnant women. Actually the battle started from home as well. While opening the door, we used to take a lot of care so that even our family members should not get frightened. Otherwise, they will say, you are going to bring the COVID in our house. And we said, don't worry, we are going to take optimum care. We had a separate actually the isolation things prepared at home as well. And we started taking care of the common actual things like vehicles, which we were using commonly. OT also we needed to modify. So we modified a lot of things, the operation theater, to avoid the fatigue fill of our own colleagues by making small changes in the positive pressure, as well as the little interior changes in the OT room. And all that actually helped us to give good services to many of our women. Now, while doing so, again, the main question was whether my own colleagues will get tired. So we always kept ourselves in duplicates. Like in one setup, for example, the Yashodhara multi-speciality hospital, where I designed actually all those things with my colleagues, we kept a set of three people, 3 anesthesiologists, 3 pediatricians, 3 OBGYNs, 3 OT assistants, 3 runner nurse, 3 attendants, so that, one after other, they used to cater the services to all those particular women. In spite of this, at one moment, few of them, they got a bit tired. They said no, because one of their relative got infection, was put on ventilator, and they said, now what is going to happen with me? And then it was a big question for all of us as well. But then we sat together. We decided that yes, whatever care we are taking, we are taking. We were actually, to start with, used to take certain medicines to protect ourselves. When the pandemic started, there was a concept that SCQs need to be taken, and all of us, we consume that. Though eventually we learned there's no much role of that. But when it came to the other protective gears, we gave them in very good quantity. I mean, we could arrange for that. But there were many other centers where they had a scarcity of this particular protective gears and the equipments. But again, as we were working with many organizations For example, the organizations like FOXY, that is Federation of All OB/GYN Societies of India, with the Lifebox Foundation, with ISOPUB, we started speaking with each other to overcome this particular issue. And when we realize, yes, there are always hurdles which are going to come up because this is new disease, this is new virus, new actually concepts we keep on, getting every day. And then even there was scarcity of many things in many of the underdeveloped countries or the middle class countries. We put a request to many of them to get the personnel, to get the equipments. I'm so happy that one of the actually center which was run by the government authority, we could provide them with good number of ventilators, BiPAPs, as well as the pulse oximeters with the help of Lifebox Foundation. So we could see that there should not be really that feeling of frustration or sort of, the thing like burnout. In spite of that, the number of cases were giving a lot of actually the problem to many of the centers. That time it was incidental that I was holding the post of President of Indian Medical Association, the local branch. So then I appealed to all my doctors and their colleagues in the hospitals to come forward. And to my surprise, 23 hospitals came forward to join this particular mission. And that created more strength, more confidence. It created sense of, giving something for the society. And though the scenario was absolutely like burnout or tired, all of them, they decided that we'll divide ourselves and we'll work actually accordingly to avoid ourselves getting exhausted. And that's how I think the things can go about. In between, we used to always meet on the Zoom platform to understand if there are any difficulties. There were certain incidences where the people actually, one of them, few of them were tired. We said them, yes, you take a break. We gave them a break of almost 15 days, 1 month, because that is a demand as well, as they were having a lot of physical stress. Fortunately, we had certain people like Jahnavi also in our team, I mean to say the psychiatrist, who came for the counseling, actually the help, and they were speaking with these providers to tell them what exactly the situation. And quite often we realize it is because of their family members, they were more tired because they were thinking that whether they're going to bring that disease to their old parents or other family members who are staying together in one, actually the home. Because in India, the joint family is a very common structure. And in one family, there are many actually generations they live together. But then we arrange for the hotels, we arrange for the separate rooms for those who were working there, and we could overcome this particular issue of getting tired while working So there are many actually such situations which can be managed. And I think we can discuss a little more as well as it comes with more questions from the participants, because that will be something really interesting as well. So thank you very much for allowing me to share my experiences. Thank you.
Perfect. Thank you so much, Milind. And there's one of the things that both you and Bunmi have both mentioned, I think, is in the initial COVID response, this huge push and stress to the system and this desire to respond to that very quickly and to see people coming together. And I know that, Jeff and Jahnavi, I think both of you have had that experience, and I'd love to hear your thoughts on what that response looks like. And then once you're several months later, how that transforms. So love to hear your thoughts on it. I'm going to first go to Jahnavi, to you, because I think you have some slides to share and some experiences as well.
Yes, sure. Thank you, Mary. I would like to share my screen now. I think what Milind has shared just now has really been fantastic, and I think when we talk more about dealing with burnout, I think we can just see what all steps they took, and we will see what all things can be done. But especially at the beginning of the second wave, we had a lot of people who were already exhausted. We started looking after COVID patients from March last year, 2020. And then in, say, February, March 2021, again, we were back. And this time with a bang, because the number of patients were too many, and the scarcities were also quite a lot. And so everybody was very tired. People doing COVID duties, there were very common statements that were made, and so many people told us, they kept saying, I need a break. I just somehow want to finish my duty. I feel that things are just not going to change. I remember one of the residents who came and said that anyway, it's always going to be like this. We just have to keep on doing our duties, because she was a psychiatry resident and continuously was doing COVID duties, missing out on her training in psychiatry. And so she was saying, then what's the point in being here? Means, did I take up psychiatry because of, for this? I have wasted about 6, 7, 8 months doing just COVID work. And so I feel, just if there is nothing that's going to change, then why do anything at all? I've already given up. There was somebody who said that, actually in my duty, every day there was a death last week. And I think I have stopped caring about all these things. So, even if there was a death, I really did not feel much for it. She was the same resident, actually, who had come to me last year saying, or sharing her experience of an old man who had improved and was going home. And while going home, he gave her blessings like a grandfather, saying that you will do so well in your life. And so she was so happy, because the experience had been so gratifying to her. But this year, when she had to do the duty, this was a reaction that I really don't feel much now when I see a death in the ward, because it has become such a routine. And I feel, what am I doing here? I'm just tired. These were people who had not gone home for 8 months, 9 months, 1 year, and incessantly had been working in COVID wards. I think what COVID was really, I should say, the most important thing COVID did was create a fear. And the fear increased the level of stress tremendously. People were scared because of scarcity of equipment, whether I have enough protection to go into the ward. Initially, that was the thought. Secondly, whether I will get infected. If I go home, whether I'll carry the infection back home. Not only that, if I get infected, what is going to happen to me? Because being a doctor, or being in a healthcare professional, being a nurse, working in the hospital, I know that actually there is no cure to this disease. What we are doing is all experimenting. Every 15 days, there is something new that is coming up, and we are trying out different things. So if I fall sick, what will happen? That fear was also there. Not so much in youngsters, but in middle-aged, senior people who have been in service, who have been working in the field, who have been practitioners for 20, 30, 40 years. Those were the people who were more scared, worried about their health. And youngsters were worried that they would take the illness back home. Especially, I would say, people who had young children. They were really in a dilemma whether to continue working or not to work at all. People, in our country, Pandemic Act came into being, because of which people could not really leave that easily, could not resign that easily. Otherwise, I'm sure a few people would have definitely resigned and gone away, would have thought that it's best that I don't remain on the scene, let me go back. And then once the pandemic is over, probably I'll see what to do, how to come back to practice, and what to do with my career. I remember one intern telling me that this is not what I had opted for, Medicine has always been my passion, but this is not what I signed up for when I joined medicine. And so actually I'm wondering whether I have done the right decision of joining medicine, whether I should have done something else so that I didn't have to face all these things anymore. So these have been the kind of dilemmas in people's mind. These have been the kind of experiences that people have been sharing with us. And I feel it's not just that one experiences it, but as Jeffrey has said, if I am not experiencing, probably the other person is experiencing. And so there are many who have seen their colleagues talking about all these things. Sometimes if one person is coping well, he or she would think, why is he talking like this? And probably understanding also. There have been definitely, as Dr. Milind has said, there have been incidences of suicide attempts or suicides by healthcare workers out of frustration, being exhausted and not knowing how to deal with the situation. I think burnout has been pretty high, and lot of upheavals because of the burnout. And initially it was bravery, definitely trying to figure out how to fight with this illness. But as the days went by, I think more and more exhaustion set in, and because of which people really got tired, frustrated, didn't know how to deal with the situation. And as I said, some amount of detachment came up, some amount of indifference creeped into their attitude towards their patients. Yes, Mary.
Okay, perfect. I just didn't want to interrupt you.
I'll stop sharing because the remaining slides are about dealing with burnout, which I think will take a little later. Right?
Perfect. And I want to come back to Bhumi, but I also want to give us a lot of time to talk about these solutions that you've mentioned, because I think many of us who are on the call today have really been trying to figure this out. Jeff, I see that you put up your hand. Love to hear your thoughts.
Yes, one thing I was just going to add to all of our presentations so far is we're all talking about present tense. We're all talking about burnout occurring now or in the past few months. One of the situations that I think will be relatively unique for us as physicians with COVID is we have an artificial binary choice of not being able to take a break during this particularly stressful time. Everybody either has to quit their jobs or keep working under this tremendous fear and stress. So I am concerned that down the road, once we have COVID under control, there's going to be a tremendous wave of physicians that are in tremendous stress and need. It's like when you're running a marathon or you're in a military firefight, you can't quit. But once it's over, there's a greater degree of fatigue and breakdown.
May I say something, Mary?
Please.
I think it's a very important statement that Jeffrey has made, and keeping that in mind, I think what we need to do today is work towards preventive strategies, beginning today, so that in our own places, well, let's try and stop that wave of burnout if it has to come in the next few months or after COVID is over. Isn't it?
Yeah. And Jeff, you've previously shared before that slide of how people respond to these types of stresses. And I found that slide was really helpful for me in thinking about what our response is often like as an organization, and as individuals when we encounter these stresses. And I don't know if you've got it on hand. I got to go to Bunmi to get some of her perspectives, but
I'll find it.
Yeah, that would be great. So Bunmi, we're going to come back to you, and I'd love to hear a little bit about the experiences that your team has had, but also perhaps we can start shifting the conversation a little bit to some of the responses that we've had to burnout, some of the things that may or may not have worked. Would love to get your perspective on that as well. So, and Bunmi, it seems like your signal and your connection is much better now. So we're really looking forward to hearing from you. Thanks.
All right, thank you very much. Thank you for all the great presentations. I've learned a lot as well. So for us in Nigeria, the experiences is not too different from what other part of the world experience. It's just that ours, because of our cultural background, is more worrisome. Cultural background, I mean that as a nurse, most of us are female. We are married with children. So the challenges of thinking about who we take care of our husband, who we cook, we are supposed to be there, and who we take care of the children, who we take them to school, drive you crazy. And here you are in a situation whereby you can't even go home. You can't even talk to them. At times, you are not even allowed to go in with your phone. So it's really, really worrisome. Or a situation where we find ourselves that even after 2 weeks in the hospital, you are allowed to go home. The community rejects you. The community see you as a plague, that you're not supposed to come back to us. Go back to where you are coming from. That is where you belong. So that lack of communal support, that lack of family support, that lack of understanding from the armed forces. We have several times that colleagues who go back home at night were being attacked, were being molested by the police. It's not funny, even when you tell them you are coming from the hospital. So all of these experiences are not really easy on us as nurses who have saddled with the responsibility to save life. Now, the issue around unavailability of material, the workforce, especially the nursing workforce, is so minimal. Many people have been retired. The government are not employing. We have fewer hands to take care of patients. Now, in the fewer hands that we have, lack of the required equipment and material to work with, like the PPE, lack of or inadequate drug supply. They are major issue that you want to help a patient. The patient is dying, is into crisis, but you cannot just go in. I've seen a scenario where I was on admission. I had COVID myself. In the line of taking care of patients, I had COVID. I was on admission. I was on oxygen for 2 weeks. I was afraid of death, just because I'm caring for patients. You understand? Again, at some point in time, someone close to my cubicle had crisis and nobody could come in. Why? Because there's no PPE for the nurses, there's no PPE for the doctors. They were all at the entrance to the cubicle and they cannot go in.
I would just comment, they are very potent and personal comments. And one of the things that, struck me is we do our work for our own internal reasons. But a lot of it is because of the satisfaction we have of helping people. And we do want recognition, and it doesn't sound very humble, but we want to feel needed and desired and praised. And instead, when you are doing your job, you're frightened of doing it, and you're chastised, let alone beaten by authorities, or you're feared by patients and colleagues, that adds to the kind of isolation and stress and the feeling of being burned out. It shifts the scales from reward to punishment.
And I've got to say too, it resonated with me very strongly, this sort of rift between sort of community and ourselves as practitioners. I mean, and us in North America, we're seeing that as well, and a little bit differently, where there's this thought about the responsibilities of the community, which we don't usually think about. But for us, a lot of it is around vaccines right now. And that's really created, and it comes back to some of the things that many people have talked about. Dr. Kedare, you've mentioned this. Jeff, you've mentioned this loss of empathy towards the community. And I think that we see that sometimes also. So I think this is a great time to start digging in a little bit to some of the solutions, some of the things that we can actually look out to help reduce burnout in ourselves and in our colleagues. And Jeff, I was going to start with you. Do you have any reflections on what we can do if we start recognizing burnout within our colleagues?
Yes. The first thing, though, like in anything we do, is recognizing the problem. You can't treat anything if you don't recognize or identify the problem. And that's, as I said before, that's particularly difficult when most of us don't want to recognize it in ourselves. So first you need to recognize it, then you need to clear the field. Just like doing surgery, you wouldn't operate if you can't see what you're working on. So you want to tease apart things that aren't necessarily stress or burnout. One of the things I want to talk about before I go into what we can do is what to expect in the future. And this was the slide that Mary was referring to. In massive disasters, communities and individuals, so think about yourselves and your colleagues, tend to respond in this fashion with the graph. This axis is community or individual functioning. It's a random value of functioning. And this is time from disaster on the x-axis. And we see, as expected, after the trauma, a decrease in functioning. But then surprisingly, and think of yourself in facing COVID, we see a tremendous increase, what we call the heroic or altruistic phase, where everybody functions better and harder and faster than they did even before the trauma. And that's because everybody's trying to chip together, work together to defeat the problem and to survive. But then, and this is important, we then see a falling off, a disillusionment and fear, anger, greed setting in, and functioning of individuals and communities are actually worse than when the trauma hit. And that's usually because resources are depleted, as people have been describing, and their own personal fears and needs and injuries begin to take a toll. So once one recognizes burnout, or how do we prevent it, there are some strategies, particularly in disasters or something like COVID. If you can prepare ahead of time, that helps you from being surprised, and it allows you to enlist the cognitive skills that are best applied to that situation. Know what your duties and roles and risks are going to be, and be aware of your capabilities and limitations. One of the problems with disasters and fear is that we can get ourselves into situations because of feeling heroic. We have to help. So yes, I'll help the good doctor deliver a baby, even though I haven't done that in 30 years. No, that's not something I should be doing, because that's not in my current repertoire and will increase everybody's stress and potential problems. Be sure you take care of your own health and medical needs. And very importantly, have a buddy, have a colleague at work that you trust and can interact with. And use that buddy to observe each other and take care of each other. And sometimes that has to do with joking. You may make jokes, but pay attention to your buddy's jokes and concerns. Don't shrug them off as, well, he or she was just blowing off steam. If you hear repeated talk of quitting or suicide or, I don't care anymore, pay attention to that and then talk to them after the joke is over. Talk to them about what's bothering them. Read between the lines. Also, this may sound simplistic, but too often we neglect to eat healthy, get our rest, and yes, you can get your rest. Exercise, read, have music, enjoy what the things you used to enjoy. Do that again. Limit your hours to 12 to 14 hours work during disaster and high stress episodes. And rotate in and out of the hot zones in shifts. That is the, in the current situation, the COVID wards. Try to figure out how you can rotate out of that to be able to get some rest, take your mask off, not be as at constant high alert. Keep to your regular schedule. Keep hydrated. Take breaks. Yes, you can or should be able to. If you can't, then you ought to have a collegial discussion with administration about the need for you and your colleagues to take some breaks. Importantly, pay attention and keep in contact with loved ones and family. Too often we focus on the disaster and work and ignore our social side and our personal side. With COVID, limit your public news and media exposure, because that makes worse this whipsawing of what's the latest trend, who's dying, how many people, what's wrong with medicine, what's right with medicine. None of it is accurate for too long. Do periodic self-assessments, watch for burnout, watch for depression. Don't ignore it in yourself. If you feel a difference in how you're interacting or how you feel, talk to somebody about it. Also, be aware of secondary traumatic stress. There's only so much disaster we can absorb ourselves vicariously. And remember, almost all of us feel inadequate in this situation. We were not trained for this, and we don't have the resources. So of course we feel inadequate. Accept that and just do the best you can. And again, if you need help, ask for it. That's probably the most important and the greatest thing that we don't do as physicians. And as a general rule, know what it is that you need to recharge or to refill and make that happen. Mary, back to you.
Thank you so much. That was fabulous. And there's a little bit of conversation that's going on in the chat as well. I'm just going to very briefly, for those of you who may not be able to access it, Bunmi has shared some of her experiences, basically summarizing those as that nurses in Africa in general, across many of the countries, face a lot of challenges from poor institutional and social supportive systems. And really what she has emphasized, and I think this has come up in a few conversations, is that there needs to be this commitment, this government commitment really to protect the health system, to allow us to do some advocacy, to ensure that the government provides what we need in terms of equipment and infrastructure and provision of mental health services. I actually reflect a little bit on some of the stuff too that Jeff has just mentioned on, sort of changing the way that we do our work and how we do our shifts. And our clinical leaders may not always think about these relatively small but important changes in the way we do our everyday practice. Another comment that Bunmi has mentioned is the importance of carrying the community on and really working to forge those relationships so that there is, I think, really some mutual support there, and also really to be honest and open with our families. So what I'm going to do now is I'm going to go over, Jahnavi, to you and get your perspective a little bit on some of the strategies that we can look at as providers to minimize the risk of burnout in ourselves and our colleagues. And you are muted, just in case.
Sorry, thank you. What I will do, most of the points have been covered by Jeff. What I will do is I'll try to connect it with what efforts are going on. I'm sure in every place. I'll talk about our place, and I will also try to connect it with what Milind has spoken when he shared his experiences, because very thoughtfully they have employed a lot of strategies to prevent and to deal with burnout. One of the important things is to identify the symptoms at the earliest. So, as Jeff has said, self-assessment once in a while is very important. How am I dealing with my work? What am I doing? Do I feel good after the duty or no? I think if you and your colleagues start chatting about it, that would be excellent. When Milind and his colleagues realized that some of them are getting tired, they decided that they need some strategies to deal with it. Once the person realizes that, yes, probably I am moving towards burnout, or that I am suffering from burnout, it's important that, yes, accept it. That, yes, okay, probably this is not a very good stage in my professional life and I need to do something about it. Important thing is, what is it that is giving so much stress? Is it the workload? Is it the stigma, as Bhumni has been talking about it? Or is it the kind of atmosphere, the fear in which I am working? What is it that is leading to so much stress? One, is it the separation from the family? And then managing stress. There are various stress management techniques which Jeff has also spoken about. Most important is taking care of self. Yes, it is important to eat well, sleep well, have some schedule of the day. After a night duty, a person comes back to the room and goes to sleep, doesn't get up till 2, 3 in the afternoon, gets up, eats something, and then by the time he starts doing something, it's time to go back to night duty. So I think having some schedule of the day when you're doing duty or when you're off duty, I think that would really help. And let's go back to what Milind and his colleagues did. They decided to give breaks. They decided to give breaks to their colleagues, probably for 15 days at a stretch. I think that was an excellent idea. On your own also, you can take a break. Maybe apply for a leave, say for a day or two, if not more than that. Maybe when you're off duty, do something different apart from your hospital duties. If you can go out and do it, excellent. If you can connect with people who are not on hospital premises, but they are from your family, who are your friends, do connect with them. I think this is one of the most important things to do, where being connected with people definitely helps in dealing with stress and in dealing with burnout. Also, it is important to recognize what kind of coping I am using. Am I being very, very frustrated because of the stress? Am I feeling helpless? Am I feeling hopeless? How am I dealing with the stress in my life? Or am I looking at it as a problem and trying to solve the problem? Milind put it very nicely. He said that we decided that, yes, these are the issues. Pregnant women are going to get into trouble. Our government medical colleges, colleagues working in government medical colleges, they are getting overburdened. What can we do? So look at the problem and try and arrive at solutions. If one can learn such a problem-focused coping style, that will definitely help in minimizing burnout. Techniques like yoga, meditation, mindfulness, there is enough evidence now, even scientific evidence, to suggest that yoga, meditation, mindfulness helps in reducing stress, helps in minimizing burnout, helps in even decreasing depression. And therefore, if one can learn any of these and can practice any of these regularly, I think that would be an excellent strategy. Yes, counseling, cognitive behavior therapy are some of the other methods where professional help will be required. Basically, if one realizes that, no, I myself am just not able to deal with the situation, let me take professional help. There is no harm. There is no harm in seeking help, in taking help. And once professional help is sought, then definitely going through cognitive behavior therapy, going through counseling will help the individual. These are all the methods that an individual can apply and can take care of himself or herself. At organizational level or in a team, at interpersonal level, can we really do anything? I think we can just go back to what happened with Milind's team and see exactly what all things they did. They worked in teams. It was an organizational effort. They carried out some modifications, and modifications in OT, in providing personal protective equipment. All these techniques they used so that burnout in the individuals would not occur. They decided to give breaks. Not only that, they provided counseling. They created a buddy system. They kept people in a group, a team of 3 anesthetists, a team of 3 gynecologists, a team of 3 surgeons. I think an excellent idea which can be planned at an organizational level so that these buddies can create a supportive network for one another. Second thing, they created a communication link amongst all the healthcare professionals so that people who are in need of care have a channel of communication, can communicate their needs, and then appropriate action can be taken. When they started working like this in an organized fashion, automatically came a sense of purpose. That sense of purpose definitely helped people deal with the situation better, deal with their burnout better. At an organizational level, what they did was building resilience of the entire healthcare worker community. At individual level also, building resilience even through this crisis can definitely help the person in dealing with burnout, in dealing with frustrations and exhaustion. So there are some strategies which can be worked out at organizational levels. What I can talk about my experience is that yes, in our hospital also at organizational level, there was a dedicated place where a break could be taken by faculty members. Provisions were made so that they could have some games. A table tennis table was put up, a carom board was put up, a chess board was provided, so that when they are taking a break, there is some other activity apart from discussions about COVID, discussion about patients, discussion about workload. There is something else that people can engage in. Even for resident doctors, such facilities were made available, especially during the second wave, when we started realizing that they are heading towards a burnout in a big way. So far as scarcity of equipment, personal protection gear was there, I think society came forward. Community came forward. Donations in the form of all kinds of equipment, all kinds of personal protective gear, not only that, all kinds of healthy diets was given to healthcare workers all over, and especially in our hospital. I would say I'm really thankful to all of them who showered us with all these things, and because of which working conditions became quite comfortable. Community participation that we have been talking about since the past few minutes is precisely this, I feel. Wasn't there stigma? Yes, there was stigma. Isn't it that healthcare workers, when they went back home at some places, they were chastised? Yes, that was true. But there was a group in the community who wanted to help us. And I think that really gave us courage. And this is exactly the kind of community participation and commitment that we are looking for. And I think for that, being connected with the community actually helps, because that is going to give us purpose. So this is how one would deal with burnout and have some strategies to minimize burnout. I think one important program that we are having at the moment is in association with Ariadne Lab and Lifebox, where we are trying to prevent burnout or minimizing the risk of burnout by training our healthcare workers in resilience building, in managing stress and managing loss. We've had sessions with mental health professionals in Mumbai where we have trained, I should say, about 30 people till now, 30, 35 people till now, who themselves will go ahead and help healthcare workers in their own hospitals in terms of managing stress, managing loss, which every one of us has suffered, especially during the second wave, and building resilience. These are three fantastic strategies to minimize burnout. Over to you, Mary.
Thank you so much. I recognize we are in the last few minutes of our presentation, and I feel that there are so many things that we could continue to talk about. I do want to make sure that if anyone in the audience has been waiting to ask a question, please do put it in the chat. There are a few reflections that I wanted to share based on these conversations and some of the chat that's been going on as well. Some of the things that I've heard are a lot about the different ways that we can respond to burnout in ourselves and our colleagues on the individual level, within our groups and teams, within our hospitals, within our health systems, and internationally also. And I'm really happy to hear that this got touched on in a number of different ways. And I think it's very helpful to have some of these solutions that we can take today for ourselves and for our colleagues in terms of self-care and care for others, and recognizing symptoms of burnout when they appear. Really want to come back to things that have been mentioned by a number of those on the call, but Milind, to come back to some of the suggestions that you had, that is really to do with working within your own hospital system to make sure that that the policies and practices that protect your healthcare workers are in place, and little things even just to do at home, and ways that we can improve our own mental health and well-being. I want to also touch a little bit on some of the things that we can do internationally. And I think it's reflecting back as part of this larger group that involves Lifebox, Ariadne, Smile Train. There have been a number of international initiatives that are underway and that are really important. And Jahnavi touched on the one that we've been working on in Mumbai, which is to really, how do we develop a strategy to help frontline mental health workers protect and support people there? How do we help empower them and create systems that are going to be effective for them? One thing which is really critically important is vaccines. And there's an area too where vaccines is not it's not an isolated issue in your own hospital, that the international community plays an important role. And we play an important role in advocating for equity in vaccine distribution. And it's been said many times during the pandemic, but the pandemic is by its very nature an international event, and our solutions need to be both local as well as international. I want to highlight also a few other things that have been going on related to work that's been done by folks who are on this call, as well as by our organizations. There have been a number of recommendations around how we manage. Milind pointed to the one on cesarean sections, recommendations that people can use to support C-sections during COVID. Milind, you're also part of our recommendations for the surgical safety checklist, and how people can use that effectively during the pandemic. We've talked a little bit about sort of strategies around healthcare workers. I think really there is quite a rich set of solutions that we can enact that will help us advocate both personally and abroad. I have just a couple of minutes left, but what I'd like to do is to open it up back to this group to see if there's any very few final points that people might want to make to share with the audience before we close up. And we only have a couple minutes, so please keep your comments to 20 seconds or less if you can.
Yeah. Can I add something? Yeah.
Yes.
Yes, because as I was listening to Jahnavi as well as Jeff, yes, very true that, the frustration of many of the times was for recognition as well, because many of these, especially physicians, we had physicians in the age group of 25 to 50, and the youngsters, they definitely wanted some recognition. So what we did, we again empower our government to tell that we need to, recognize their work in these two pandemic waves. So we call them together, call one celebrity. We gave them one certificate, and we also gave them this set of books. So what happened? We told them, you go and read these books, and probably you will be happy to, relax yourself for some time. Vaccination as well. The government passed a rule that healthcare providers will be getting priority. We told government, not only healthcare workers, but their families as well, because otherwise they are also exposed, what we call the passive smoking, because the healthcare workers are getting exposed to the COVID because of their work, but the families who are sitting at home may not be the healthcare providers, are also getting exposed indirectly. And for our fortune, government agreed to that, and they gave priority to the families of healthcare providers as well, which really gave boost to their moral to come out of that burnout sort of feeling.
Perfect. Thank you. Jeff.
Yes, just very briefly, especially listening to Jahnavi, getting professional help is often, there's stigma involved and there's a barrier for physicians and medical staff. And one of the things that I find very effective in disasters, or when working with emergency rooms and surgeons in a major disaster, is having an informal connection with a psychiatrist or a consultation liaison psychiatrist. That is, you can help your staff by bringing in somebody to just get to know people and informally talking, not treating. And that may be helpful.
All right. Actually, Jahnavi, if you just have like a couple things to add, and then I'll wrap up.
Yeah, I just want to make one point, and that is about peer support. I think it's very important to create support amongst ourselves, amongst colleagues, so that dealing with burnout, dealing with stress will be much easier. I think that's one of the effective strategies that we can think of. Thank you so much.
Perfect. So we're going to close this out now. I want to thank all of you for joining us today. We hope that you found this session useful. A video recording of the languages will be made available and shared to all participants shortly. And we really do encourage that people share this. We recognize that this is a weekend session, so some people may not have been able to attend. We'll work to produce resources, drawing together the discussion for our colleagues and our partners around the world. I specifically want to thank our speakers today, Jeff, Jahnavi, Bunmi, Milind, for stepping in at such short notice and for sharing so many really excellent stories and advice with us. I want to thank our hosts, Train-Lifebox, Safe Surgery and Anesthesia Initiative, Ariadne Labs, our partners G4 Alliance, Seed Global Health, and the Frontline Workers Coalition, and the Act for Health Workers campaign. I want to take this opportunity to express our solidarity with healthcare providers around the world as they continue to work on the front lines of the COVID pandemic. Thank you all very much, and keep safe.